A disability is something that has a major impact on your life.
Every disability is different.
And it's never the same thing for two people. I am blind in my right eye totally and partially sighted in my left eye.
I was 18 years old. We were traveling way too fast on a gravel road. Broke my neck, my back.
My Asperger's syndrome and my cerebral palsy.
I have anxiety and depression. People would have no idea just talking to me.
Being independent means different things to different people.
I want to live in my own house. I want to pay my own bills.
Live independently and not rely on other people.
When someone is not able to live as independently as they can, it does have a detrimental effect on people's physical and mental well-being.
It's no complicated thing. It's just that people with disabilities want to be included.
Plenty of people get stuck in ruts when they feel like they can't overcome something in their life. That's where LIFTT comes in.
Living independently for today and tomorrow. LIFTT. We help people of all ages and all types of disabilities find the resources or acquire the skills to live as independently as possible.
We serve the southeastern 18 counties here at the Billings office. We have a variety of things that we offer. We can help with grant funding for adaptive equipment.
Maybe a home modification so they're able to access their home. We help people to find that funding.
Helping people apply for Social Security benefits.
Medicaid, Medicare, housing.
They have a peer support group. Peer support, I think, is key.
Sharing life experiences is one of the most powerful things to help people who might be new to disability, who might be struggling with their disability.
Youth transitions is kids that are transitioning out of high school. They need to learn those adulting skills. It might be rent an apartment, learn how to grocery shop, budgeting.
Help someone advocate for themselves in a school or an employment setting. One of our biggest strengths is providing folks with information and referral. If we can't help you, we hope to know who can.
A lot of times we'll have a potential consumer call in and they think that they just have one need, and it turns out that we end up finding 3 or 4 things we can actually do for them.
You can just come in and say, hey, I feel like I have this going on. Can you help me? And we can, which is so cool to me. I love that.
Most of us on staff at LIFTT have identified ourselves as having one or more disabilities. That is helpful in many cases.
It's easier to empathize with someone when you yourself have struggled with a disability.
This is what we specialize in. This is who we are, and this is what we do.
And it costs nothing to go to LIFTT. It's a nonprofit organization and they're there to help.
Somebody that was a consumer that was working with LIFTT was asked to do an art project. He visualized that the balloon helps to lift people up. And then it became the logo, and it's stuck.
There's been success on all kinds of levels.
It's really rewarding to have a consumer go, hey, I was able to do this by myself today.
We want people to live their best life as independent as possible.
Live as everyone else in society and live as a part of society, not apart from society.
Everybody needs help. Sometimes you just need a little more help, and that's okay. That's absolutely okay.
There's plenty of life to live still, and there's a way you can do it. Keep chipping away at it, little by little by little.
Knowledge is power. Let's share it, for crying out loud.
Send us an email, give us a call. We'll do our best to help.
We can definitely help figure out what your needs are and get started on that. We're one of many steps in the path to independence, and we're happy to be serving people here in the community.
Good day and welcome to Living Well in Montana. Living Well in Montana is a program of living independently for today and tomorrow, or LIFTT as we like to call ourselves, LIFTT. LIFTT is what is known as a Center for Independent Living, meaning we are a source of programs, resources, and advocacy for people with disabilities and the aging across our 18-county service area of south central and southeastern Montana. For more information about LIFTT, please give us a call. Our Billings office can be reached at 406-259-5181. For those of you watching in eastern Montana on the web, it can be reached at our Glendive office can be reached at 406-948-8500. And from anywhere in the world, LIFTT is accessible 24/7 on the web at LIFTT.org. Now at LIFTT, we talk a lot about, on this show, we talk a lot about what's going on at LIFTT, and in recent weeks and months, we've talked a lot about some new programs that have materialized over the last year or so. Today we're going back to one of what we call our core programs that's been a part of LIFTT almost as long as LIFTT has been around, and that is our self-direct personal care assistance, or self-direct personal assistance services, depending on maybe that's a good question to ask our guest, but again, I won't say too much here, but again, the Self-Direct Personal Care Assistance Program is designed to allow folks who are eligible through Montana Medicaid to receive certain services in their home, as opposed to being institutionalized in an assisted living or a nursing home. Joining me to talk a little bit more in depth about what the self-direct program is and how people are eligible for it and how they can find out more about it is our Program Supervisor, Lanette Brown. Lanette, welcome. I believe you and I did one of these 4 or 5 years ago now. Wow.
A few years ago.
And welcome back.
Thank you.
And so again, I briefly sort of explain what the Self-Direct Personal Care Assistance Program is. Maybe you could give the longer explanation to start off with.
Well, I don't know if I can give a longer one, but our Self-Direct Personal Care Assistance Program is run through the state of Montana, through the Department of Public Health and Human Services. It is based on Medicaid eligibility, and you must be standard Medicaid. That is something that a lot of people don't always fit into, but there is ways where you can become Medicaid eligible, and so you just need to talk with your Office of Public Assistance on that.
Right. Okay.
Our program mainly works with people who need hands-on assistance. Hands-on assistance means that it's not just prompts. They actually need somebody to physically help them. So some of the tasks could be bathing, dressing, hygiene, toileting, food preparation, and things like that, with minor household cleaning tasks, shopping, and community integration.
Okay. Self-direct is a pretty big word in all of this. What exactly does that mean, and how does that differ from other types of services that may be out there?
So the department has at least 3 different ways that you can get services. You can get services through the self-direct program. Self-direct means that the individual or the consumer will direct their own services. They will manage and care. They will find their own caregivers. They will make sure that all of the paperwork and everything is correct when turning in time for those tasks. And then the agency-based, they actually send a nurse and send people out to do that for the folks. And so with the self-direct, LIFTT really likes that program because that means that the consumer themselves are able to be in charge of their own lives.
Right.
And that's the whole goal, is for us to keep people independent in their homes and in charge of their life.
Okay. Interesting. So let's sort of do a what if, I guess,
Okay.
is a lack of a better term. So say that somebody I know has the needs for, as you said, the hands-on care, and would like to investigate being a part of the self-direct personal assistance program. What are sort of the steps they would need to take?
So they would need to call LIFTT and
Okay.
ask to do a referral, and we would go through all of those tasks that are authorized. We would check to make sure that that person is eligible with Medicaid. We do have a way to do that. And then we would send that referral on to Mountain Pacific Quality Health. Once the nurse there at Mountain Pacific Quality Health, and they're the governing agency for Medicaid in Montana. Once the nurse has authorized tasks and time, they will send us paperwork back, and then we do an intake. Once that intake has been completed and we get the people educated on how to do what we call electronic visit verification, which is EVV, then we also have to have an application form for their caregiver. Then once that's all completed and into the computer system, they get to start services.
Okay. About how many consumers do we have on the program currently?
I think we have right about 110 currently here
And-
in Billings area in our district.
Okay.
We have 8 in the Glendive area.
Okay. And how many caregivers is that?
That depends on the individual. Some
Right.
individuals have 2 and 3 caregivers each.
Right.
Others only have 1.
So you don't have off the top of your head, you don't know how many caregivers?
I think it comes out to be right at about 180, but
Okay.
I'm not positive on that.
All right. So yeah, that's 180 people who are receiving benefits, and it's been my experience sort of watching from the sidelines these last years that it's often the most successful self-direct consumers are those who have a family and friend network that is already caring for them, and this is a way for them to make it economically more possible for them to do that, what they're already doing, correct?
Right. A lot of our consumers, they are in the position that they're in, and able to stay at home and able to have the cares only because family is willing to step up and help. And this just compensates the family. Some family members would have to go to work, others don't.
Right.
And so it just helps compensate for them to have assistance in the home and keep things pretty steady.
Okay. So you've been with LIFTT at least as long as I have, 15 years.
I've been there 16, and I'm
okay.
headed into 17.
All right. Have you seen changes in how the personal care assistance program operates? What consumers are able to, what services consumers are able to access through that? And again, we'll get to EVV in a moment, but just the sort of the I mean, we have these programs that we talk about in our internal, like, several years ago, Community First Choice became part of the mix, and again, what does community first choice mean, and has that made a difference to our consumers?
So when I started back in 2008, what was on the consumer's profile from Mountain Pacific was what they could use. There was no flexibility to it. There was no interchangeable of any type. It was, that's it, and that's all, you know. Where in 2014, Community First Choice was added. It's another program that was added to the program of the past program. And we use those terms which most people probably don't understand. But when Community First Choice came into being, that gave flexibility to the program. That also added some tasks. So that added flexibility. The state only could authorize 3 bathings per week for a person, whereas now they can have up to 5 depending on how many days a week they have the other tasks. And then the flexibility came into being where they could also have Community First Choice, which is community integration. On that part of it, that means that person can get out into the community. That person can go to the bank, they can go to a rodeo, they could do all kinds of things with that time. And it's time that's given to them just to be able to get out of their home.
Right.
And so that has helped a lot. And that's flexible. It used to be that shopping, you had to do shopping if you said it was going to be on Wednesday. You did it on Wednesday. You didn't have the flexibility to do it on Thursday or Saturday or whenever. And so that's where Community First Choice was a very positive to the program. So now that person can do a little flexibility on what they want to do for the day.
That's interesting. Do you have an idea about how many, I don't know whether you break it up in hours or days, or how many does our average consumer?
An average consumer usually gets about 1 hour a week to do community integration, but they get 2 hours for biweekly. So if they decide that they want to use all 2 hours in 1 week, they can do that. That's the flexibility part. They also get shopping, and they usually average about an hour each week for shopping. But say they want to go to a rodeo and it's going to be 4 hours. They can waive the shopping and they can use those 4 hours and go to a rodeo. So that's where flexibility helps.
Okay, that's very interesting. And you mentioned it a little while ago in passing, and I said we'd come back to it. In the last 18 months to 2 years, again, it had been talked about for 2 or 3 years before that, and then the pandemic kind of got in the way, and some internal discussions in Washington. But we now have a system of what is called, as you said, EVV, Electronic Visit Verification. What is EVV?
So EVV is an app on your phone.
Okay.
It allows the caregiver now to, instead of doing it on paper, where they used to check in and sign out on paper, they now can check in on the phone. It GPSes them when they check in. So it needs to be in the location of the home where the consumer is. And then they go and do their tasks that they're allowed. And there's a amount of time that's allowed for each individual, and that varies depending on how many hours for the biweekly hours that they need. But long story short, they check in and they check out. Instead of on paper, they do it in the computer, they do it on the phone, do it on tablets. And then actually the computers, they're phasing those completely out. So they want it strictly on a tablet or on a phone, and they prefer the phone.
Okay.
Because then that GPS location has to be in the home when they check in, and it really needs to be in the home when they check out.
Which, again, as I go back through, some of the advocacy we did as this was being as this was being proposed and implemented, isn't that kind of a barrier to true community integration, that they want to GPS people in their homes?
Well, the reason why they're GPSing them is because how do you do bathing when you're at Walmart?
Fair enough.
Or at the lake?
Fair enough.
Or some of the other places. So that's the reason why they want the GPS when they start to be in the home, so that they know that the consumer has been helped with bathing, dressing, hygiene. First thing in the morning, they've gotten them breakfast, and then they've gone and done things in the afternoon or later on in the morning, like going out, going to the bank, whatever they want to do. And then they want to also see that consumer, when they get home, that's why they check out is at home, because they want to make sure that consumer made it home and was made comfortable.
The end of day tasks are complete. Okay.
Right.
Well, there's some logic to that. So what? And another term that we hear that a lot, at least I hear in the background in the office, is med escort. Are those hours assigned specifically for PCAs to help people go to the doctor? Or?
So if a consumer is unable to get from the car to the doctor's office and needs help when at a doctor's visit, then back to the car, the caregiver can get paid to do that if it's authorized by Mountain Pacific. One of the things that a lot of people want is transportation. There's Medicaid transportation, which is a program within this program where they can call actually directly, as long as they're on Medicaid, they can call Medicaid transportation. They can set up all of their appointments for the month or for the week.
Right.
And Medicaid transportation will pay the PCA or their family member to drive them to their appointments.
Okay. So.
And that's above and beyond the hours that are allowed for any other tasks.
Right. Okay. That's what I was coming up with, that there is a delineation between the medical and the community integration. So again, you've done this quite a long time. You must have, again, we all have sort of our success stories in this business, and you don't have to name names or anything, but could you give an example of what this program has meant to a person, a specific person in our community, or specific people?
Well, when going out on visits, because we have to visit them twice a year, we have to be in their home and physically put eyes on them twice a year. So when going out on those visits, a lot of the folks are really just thrilled that they're able to stay at home. I think the success of the whole program is the fact that it's flexible, so it can meet your needs. It doesn't meet every need, but it can meet a good portion of those needs. The program is based on family support and friend support, and so you need that good network so that you have that to rely on, because it's not a 24/7 program. I mean, the highest hours that they can get is 84 in a 2-week period.
Okay,
so,
and that's about a quarter of,
excuse me?
But that's about a quarter of what 2 weeks is in total hours.
Well, it's 42 in each week.
Yeah, because there's.
And so, you know, if you're a quadriplegia, quadriplegic and you need more help than that, you've got to rely on that family friend network, because it just doesn't cover it all. That's one of the big questions that we have a lot is, well, Dad just can't do anything for himself, so we need 24/7 care. Well, Dad does sleep, and he doesn't need care when he's sleeping. So you have to take that in consideration, and maybe a son or someone else can come in the evening hours and assist Dad for a few hours. But he can be left alone for a couple hours here and there.
Right.
And so that makes a difference.
Yeah, and like I said, I've noticed just in observation that the folks who last the longest on our program are the ones, because of that self-direct angle, and not everybody is able to or willing to self-direct. Again, the assistance that you and your team provide is some of it, but it's not the same as an agency, obviously. So,
well, agency actually sends the people in and schedules them. We don't do any scheduling because that allows the consumer themselves to be able to schedule when they want that person in. So if he's an early riser and say he likes to have his coffee first thing in the morning, which I do have one consumer that'll tell you she won't get out of bed until she's had her couple drinks of coffee. So one of those fun pieces about that is that the caregiver can come in, she can give her the coffee, and while she's drinking the coffee, she can get her ready to get out of bed.
Right.
And get her ready for a shower or a bath and go from there.
All right. So again, the key components of what folks need to know is that this is a Medicaid program.
Correct.
Which in the people who are looking for services need to be on what is called standard Medicaid.
And Medicaid has many levels.
Right.
And standard Medicaid is one of the levels, and that's the only one that this program will work with.
And again, if people need help navigating the Medicaid application process, again, that is one of the things we do on our side of the LIFTT house in the independent living program. So again, we got about a minute or so left here. So again, if you're interested in the self-direct PCA program and want to learn more about it, please give our office a call at 406-259-5181 or in Glendive at 406-948-8500, or send us a message through our website at LIFTT.org. And again, that goes for not only the personal care assistance program, but if you would like to learn more about our independent living services, our health and wellness programs, and everything else that we've got going on at LIFTT, you can find it either on LIFTT.org or by giving us a call. Lanette, thank you for doing this, and thank you for taking us through the ins and outs of the PCA program. And thanks to everybody who watches this on Community 7 or will watch this later on the internet. We do appreciate it. If you leave a comment, we do see it. Thank you and good day.